I remember weighing like 145 pounds going into 6th grade, and it didn't really seem that big of a deal to me, except at the time our local high school had like free physicals and all my classmates were with me and they all weighed so much less than I did. And then I remember graduating high school and that was the thinnest that I had been in my adult life, and I weighed 207 pounds. And I remember thinking that that was skinny. I'd say all my life it's been a struggle. My weight was starting to affect my health. I remember as far back as my first pregnancy. She's 12 now, but during that pregnancy I had preeclampsia, and they mentioned that that was very common in overweight people. With my second pregnancy, I dealt with high risk and diabetes and that type of thing. I have a very close family member who died of diabetes and with the struggles of diabetes, and had lost fingers and her eyesight, and I just really didn't want that to be my path.
First time I remember meeting Jessica was in the office for a consultation. She was interested in weight loss surgery. She had 3 young children. It was really hard for her to keep up with them, and she was just very much interested in getting more energy and getting more control over her life.
I do remember looking at pictures and thinking that cannot really be what I look like. And that kind of was around the time that I said I wanted to do something. There's
some different options in weight loss surgery today. There's a gastric band, gastric sleeve, even gastric bypass. She felt that, and I've agreed with her, that a gastric sleeve would likely give her better weight loss results than a gastric band.
I had a friend who had this exact same procedure, and he was extremely successful and did amazing. And so really between that and Dr. Gore's personality and the team and just the information that I gathered, that was really what made me choose Floyd. It was a little scary to think that, you know, this is permanent and, you know, there is no going back. I can't have this removed, and I can't say, oh, I'm going to go on a cruise, so I'm going to have it loosened. I can't do that. But I felt like that was what I needed.
We're actually making your stomach smaller by removing a big portion of it. You're left with a stomach about the size of a banana. So it reduces the portion size of the food that you can eat. And also, there's a hormone released by the stomach tissue called ghrelin. And by removing this stomach tissue, you're actually releasing less of that hormone, and so you get less stimulus to be hungry.
I think it's great for southern Indiana residents that they don't have to travel across the river, that they can have the same care here at Floyd Memorial Hospital. You know, a lot of patients are concerned how long they're going to be down, maybe after surgery. With these surgeries done minimally invasive,
patients go home the day after surgery. We're making very small incisions in the abdomen. It's called laparoscopic surgery. A lot of abdominal surgery is done that way today.
You see the results almost immediately. In the first month, I'd lost probably 20 pounds, but in the first 6 months, I'd lost probably 50 pounds. And by the year mark, I had lost almost 100 pounds. You know, it's slow and steady. It's not a sprint, it's definitely a marathon. Now that I've had the surgery, I feel amazing. I have a confidence that I didn't know I was lacking. When I put my seatbelt on now, I can do it in one motion. I can reach and put it on. I can sit on the floor and play with my kids, and before it was miserable. I can, you know, work in my yard. I can pull weeds and not be uncomfortable. Things like that are things that people that have always been overweight understand, but people who've never really dealt with that don't know the struggles of that. It's an opportunity that this surgery and this staff afforded me that I wouldn't have had.
We just have a good staff here, a good team. It's not just about the surgeon. It's about having a nutritionist and a nurse and the rest of the staff. That's really important here.
At Floyd Memorial Hospital, we do monthly seminars, which is always a nice thing for patients to kind of get introduced to all the different procedures that we do. Kind of gives information about obesity, about all the diseases obesity causes.
If somebody would have told me 2 years ago that I was missing out on life, I wouldn't have believed them, because I was happy and I was content with things. But now looking back on it, and they say, can you believe what you're missing out on? I can't believe that I didn't do this surgery years before, because now life is so much fuller, so much richer than it was. It is amazing that it's offered here.